Good afternoon, everyone, and welcome to this regularly scheduled meeting of the Public Health, Environment, Civil Rights, and Engagement Committee on February 24th, 2020. My name is Philippe Cunningham, and I am the chair of this committee. With me at the dais are Council Members Cano, Schrader, Johnson, and Council Vice President Jenkins, as well as Vice Chair Gordon. Please let the record reflect that we have a quorum and can conduct the business of this committee. Colleagues, we have 3 consent agenda items and 2 discussion items. We'll go ahead and move through the consent agenda, and then I look forward to 2 very robust conversations that we have on the agenda for today. So, item number 1 is approving a slew of appointments to the Minneapolis Advisory Committee on Aging. I recommend for folks to go to the LIMS website to find out more information. These folks are incredibly experienced, and we're really grateful to have them as a part of this committee. Item number 2 is confirming mayoral and council appointments to the Transgender Equity Council. I will make the same recommendation. And item number 3 is referring to staff the subject matter of an ordinance amending Title 10 of the Minneapolis Code of Ordinances related to food code, amending and adding provisions related to food catering. I will move approval of those 3 items. Are there any questions or comments from my colleagues? Seeing none, all those in favor, please signify by saying aye. Aye. Those opposed say nay. The ayes have it, and those items carry. Colleagues, next up we have our 2 discussion items. The first is receiving and filing a presentation on the 2019 Climate and Health Resilience Hub pilot from the Minneapolis Health Department, the Minneapolis Sustainability Division, and Little Earth of United Tribes. After that, we will receive and file an update report relating to the Office of Violence Prevention Strategic Planning Process. So with that, who kicks us off? All right, come on up and introduce yourself for the record. Welcome.
Thank you. All right. Chair Cunningham, Council Vice President Jenkins, and committee members, thank you very much. My name is Catherine Harrison. I'm a senior public health specialist in emergency preparedness here at the Health Department. I'm co-presenting today with Kelly Mullman from the Sustainability Division and Jessica Rousseau, Executive Director of Little Earth Residents Association. I use she, her pronouns. I'll let these folks let you know theirs as they come up. So we're here today to give a summary update on our Climate and Health Resilience Project. This was an initiative funded by Pew Charitable Trust Health Impact Project in 2019. And we're going to begin by doing a little bit of grounding of our project in some important climate and health equity context. We'll then dive into what resilience hubs are in general and what implementation of our pilot looked like. And we'll end by sharing broad outcomes, challenges and wins, and where we see this work heading. So to begin, we want to remind ourselves that although our state and city are ranked best for a number of quality of life measures, as this headline notes, there are big qualifiers that go with that statement and these accolades. And this is important because as we talk about climate resilience, we also have to talk about climate vulnerability and how it is not equally distributed among our communities. So if we look at what is more closely behind those asterisks, we see that on a number of measures, and this data should look familiar since it's from our 2040 plan, that social determinants of health are not evenly distributed across our communities. So looking here at education, home ownership, income, and unemployment by race, we know that not everybody has the same opportunity to be healthy. And this extends even further into climate and health vulnerability. So these maps from the 2016 Climate Vulnerability Assessment conducted by the city show how overall social vulnerability factors, and that measure contains a number of submeasures, some of which were covered on the last slide, factors into overall place vulnerability, in this case for extreme heat in the city. The areas most at risk for extreme heat and its related impacts are the areas in and around our north and south side green zones. Again, very familiar, I'm sure, to everybody, but worth reminding us. about the context we're doing this project in. And as we look more specifically, this also brings us to another important reminder about where we are literally situated here in the city. And that is on the cultural and ancestral homelands of the Dakota and Anishinaabe peoples. And this acknowledgement is important every day for everything we do, but particularly for our project because we know that hundreds of years of trauma through war, forced assimilation, forced displacement, and ongoing disinvestment means that our urban American Indian communities are among those groups that will be hurt first and worst by our climate change impacts. And that is exactly what resilience hubs are designed to address. That those communities most impacted will be able to not only withstand the impacts of climate change, but bounce forward into greater health equity as a result of them. In a moment, I'll turn it over to Kelly to talk about what resilience hubs are and defined, and our project, but want to pass it off first to Jessica to say a few words about this important context for the project.
Good afternoon.
Welcome.
Chair Cunningham, Council Vice President Jenkins, and committee members. I'm Jessica Russo. I'm the Executive Director at Little Earth Residents Association, and my gender pronouns that I use are she and hers. I want to thank Catherine for her progressive understanding and the compassion in regards to our Native people and our lands. The simple acknowledgement expressed by Catherine on behalf of the city is critical when beginning any work with Indigenous communities, but more so when working with our urban Native population, your constituents. This statement of acknowledgement reinforces an understanding that we are here, we are important, we are seen, we are heard, and we matter. When this is fully understood, we begin to break down the barriers that have historically siloed us.
Good afternoon, Chair Cunningham, committee members. My name is Kelly Molman. I work in the Sustainability Division, and I use she, her pronouns. I'm going to talk a bit about what resilience hubs are. This may be a new concept in terms of the terminology, but I think overall we all have a base understanding of what this is. Resilience hubs are centered in community places that are already existing trusted spaces, physical spaces, and social spaces within our communities. So they can be community-based organizations, they could be social service agencies, but usually they're for and by the community. So starting with that base and then building off of that to enhance the resilience of, again, the physical infrastructure and the social infrastructure. So you start with a building, that is a core component, and then you, in terms of the physical resilience, you look at how is this building able to withstand different climactic or other potential hazards. And so the first thing to do would be to look at the energy load and whether this building has been weatherized so it can stay cooler in the summer and not takes too much energy to heat in the winter. Solar and battery storage and or a hybrid energy storage system is very important to think if the power goes out, can this property stay up and running and just provide the essential services to its surrounding community? Communications is big. Can this, and that is also tied in with energy. Can it continue to operate and provide communications out to the community members that it's serving during a time of emergency, so that they're getting the right information in a timely manner that is in a format that's welcoming to them. The other is operations. And so on a day-to-day basis, this may look like whatever services that organization already provides. To add resilience to that, it could be providing specific trainings around emergency preparedness. It could be teaching people how to use chainsaws, because it's not something we would necessarily use on a daily basis, but if trees come down, we're going to want to know how to use that equipment safely, not just distribute chainsaws without any training. And that's similar to programming. So what kind of educational resources are there out there that the community organization is already providing, and what can be enhanced or added on to build the resilience of that community so that it is less dependent on any city resources or other government agency resources, and it is internally resilient itself. So with our project, we will be talking about these specific components that we worked on: emergency preparedness workshops and kits, the memorandum of understanding between the city and Little Earth of United Tribes, healthy homes visits, energy efficiency upgrades in the townhomes, and a solar feasibility study, as well as more.
I have a question or comment from Councilmember Johnson.
Thank you, Mr. Chair. I like the diagram and talking about the different ways that a building or structure can play a role in resiliency. I was thinking about the wildfires in Canada that I believe last year or the year before were actually bringing smoke into the Twin Cities, which there's a lot of populations within our communities that are vulnerable to smoke, and thinking about the fact that really we haven't seen this here, but I know there's some other cities looking at which have installed a certain spec of air purifiers and building air conditioning, not temperature related, but to purify the air that can serve as emergency shelters for those that have respiratory vulnerabilities. Is that something that, when you're looking at resiliency hubs and thinking about how we're resilient against climate change and we support those in our community, is that something that comes into a picture like this? Is it that specific, and is that within scope of the work?
Yeah, Chair Cunningham, Council member, absolutely. And it would really be based on whether that was a unique vulnerability or characteristic that the community wanted to address. And so while these are the core components of a resilience hub, each one is really designed individually based on what the community needs are in that area. And that could be based on what are the climate changes that community is going to be experiencing? What are the environmental hazards that community already experiences? What are the health impacts that community already has? So it's a very intensive process of building relationship with community of that community organization with the residents around them to understand what are the services it's already providing, what would it need to do to enhance its services to meet those specific needs of each community. So if there theoretically was a network of resilience hubs across the city of Minneapolis, each one might look a little different.
Okay, this is really helpful. Thank you.
I actually have a question too. So when you say buildings, can you elaborate a little bit more on what that means? Is it commercial buildings, community centers, multi-family housing, all of the above? If you could explain a little bit more, that'd be appreciated.
Yes, Chair. It could be all the above. I think the concept was really designed around community centers, and a resilience hub doesn't necessarily include sheltering. And so that can be a component that is added, again, based on the needs of that particular community, or if that is a service that is already provided by the organization that is hosting the Resilience Hub, but not necessarily. So it doesn't have to have housing units. It doesn't have to have space for sheltering. It doesn't have to be a commercial property, but it could be depending on different communities.
Great. Thank you so much.
Mm-hmm.
We have a question or comment from Council Vice President Jenkins.
Thank you, Chair Cunningham. To Councilmember Johnson's point, I think we do have smoke coming from Northern Metals Fire in Becker, Minnesota right now that we need to really be addressing. But my question is more around infectious diseases and viral impacts that are really impacting our international community and potentially right here locally. Will these resiliency hubs be prepared to help deal with some of those challenges, or will these be hubs that can be more satellite locations for the health department and other entities that address those issues?
Yeah, Chair, Council Vice President, I'm actually going to ask Catherine to respond to that question since she's deeply immersed in that work.
Yes, I am. Fun time right now at the health department. Council Vice President Jenkins, Chair Cunningham. Yes, thank you. There are a number of ways that I would envision a resilience hub providing services, or as you mentioned, satellite locations. We have something called points of dispensing that we activate in an infectious disease scenario. We're actually preparing for a full-scale exercise to simulate a bioterror event that you will all be invited to observe. And so if we were to establish a pod at a resilience hub, it would provide a space where either we could do direct distribution of medication and depending on the type of medication, if it's just dispensing of pills, we can train the staff there to then get it out to the community, or we can set up our own kind of satellite clinic there to do that. I'll talk a little bit about the emergency preparedness trainings that we did, but part of those trainings in this project, we did provide everyone who attended with a supply of N95 respirator masks, the kind that are in very short supply all around the globe right now for coronavirus. So that is one way, or just two simple basic ways that we could see using these hubs, not only for climate disasters, but really any type of public health emergency.
Okay, thank you.
Thank you for that question. Council Member Johnson.
Thank you, Mr. Chair. And you may get to answer this, so pardon me if I'm asking ahead of something you're going to present, but how many resiliency hubs do we currently have, or what's the goal of how many we expect?
Yes, Chair, Council Member, we'll get to that a little bit towards the end of our presentation, but right now we don't actually have any resiliency hubs in the city of Minneapolis.
Okay, thank you.
Yes. So quickly, I just want to mention that this project is really a network of partners that have come together to do this work, and it would not have been possible without all of them working together. And so Catherine with emergency preparedness and the health department, myself with the sustainability division, Ron Harris, Chief Resilience Officer, was also a participant in this work with us. And then our critical partner with Little Earth of United Tribes. I also want to mention that some of the work I'll be showing later, we did a small contract with IPS Solar for the solar feasibility study, and also worked with MooGrid Analytics and Solar Bear. And then Center for Energy and Environment was the one who helped us with more of the energy efficiency components. But I'm going to turn it over to Jessica now.
Thank you. Chair Cunningham, committee members. So it was important for Little Earth to be a part of this project for a number of reasons. One, in our small geographic area, we are comprised of over 1,000 different residents between youth and adult aged. Our intent is to create opportunities that will increase each resident's quality of life, increase residential engagement, increase educational opportunities, and build a community that is healthy, thriving, and self-sufficient. Going off of what you were just talking about with the resiliency hubs, what is of most concern for our community comes directly from our community. And so we don't always think long-term as a residential community. We think in the immediate, because we're constantly victim to so many catastrophic things that happen to us as is. So it's critical for us to move forward proactively with the city of Minneapolis to work toward the idea of getting to this place of a resiliency hub. Because one of the things that we don't want to happen in our community is to have our community members displaced. Also, as imperative in our community is the fact that we turn to each other, no matter our disparities that we face. And so it was essential that we had the city helping us with this long-term projection to figure out where do we begin and where are we going. So this is why this work was important to us. Also, just as important was to any nonprofit is the funding that came with this particular initiative. It can be very scarce, especially in our world. Lyra would like to express extreme gratitude to the city of Minneapolis for the resources provided to our community, whether that be in the form of staff time or the educational or supply costs that were associated with this project. And I'm hopeful that these expenses will save the city of Minneapolis in the long term.
Chair, council members, I'm going to kick us off by going through the components of the hub that the health department worked directly on, I want to reiterate that this was a very complex and ambitious project, initially slated for 10 months. It was, in effect, about 7 months of work. And so I'm going to go through these at a very high level, always happy to talk about them more. So first, our first sort of direct resident service and engagement component were these emergency preparedness trainings and the memorandum of understanding that we established with Little Earth. We did 11 workshop sessions in which we assisted families in creating their family emergency plan, delivered kits that had been co-designed with LIRA board members who are also residents, and Little Earth staff, discussed the climate context of this planning, and talked through cultural considerations in planning and emergency supplies. The Memorandum of Understanding is basically a risk communications framework that allows us to share information with and through our community partners in the event of a disaster. It also gives us some infrastructure to do continued training, technical assistance, and planning with Little Earth for their own emergency planning. And that can take a number of forms. I'll just quickly share briefly that as a result of this project, we received a request from another program within LIRA to do a community workshop around public safety. So not necessarily a climate disaster or other form of natural disaster, but like, what do we do beyond lockdown when there's an event in the community, which not only speaks to what the immediate priorities are, but how we can bring our skills and processes to meet some of those needs, even if they're not within our traditional scope of work. In the end, we trained 100 residents across these workshops and delivered some tailored trainings based on the specific community group we were meeting with. The other piece I'll talk about is the Healthy Homes visits. So this program is run out of our Environmental Services Division, and these visits are designed to improve indoor air quality and reduce asthma symptoms for children eligible age 0 to 21. The visit consisted of outreach and engagement, followed by a family interview, home inspection, and delivery of products. We delivered over 500 products, a total of $21,000 in the form of indoor air purifiers, furnace filters, pillowcase covers, anything that will help improve air quality for children in the home. And we did this with our goal was 60 families. We met with 60 families. It's worth noting and touches on some of the other, areas of need is that we initially enrolled 80 families to receive these visits. So through either just not being able to meet with them or other barriers, we were able to reach 60, and we probably engaged a couple hundred in interest in having the visits. So finally, this is the part of the project that is most technically challenging, I will speak for myself, to understand, and is not directly related to work done at Little Earth, but is really critical for building our capacity in the health department to deliver more energy efficiency projects across the city. So through this grant, our environmental services team was able to partner with Center for Energy and the Environment to procure a set of technical specifications and installation standards for energy efficiency projects so that our home inspectors, who are very experienced, well-versed in lead and asthma modifications to a home, can integrate weatherization into those visits as well. Weatherization services, energy efficiency services are often out of reach for many of our low-income communities, but we know that there's support from the city and our climate goals to bring these services for those folks. So having the in-house capacity to more efficiently go out to bid on some of these projects is really crucial for scaling up access to them. And there are staff here that know much more about that if you have more detailed questions. And with that, I'll hand it off to Kelly for her aspects.
So I mentioned that energy efficiency was actually a component that was built into this project, and that was entirely through Center for and environment and the utility resources that they received through the Conservation Improvement Program. None of our grant dollars actually went to this part of the project, but because of the services that CEE offers, they were able to come into the townhomes, townhome units and do a lot of direct installs. So I have here listed that it was 58 families received LED lights, programmable thermostats, high efficiency shower heads and faucet aerators and weather stripping. I believe this number may actually be higher, and in terms of the actual potential savings of all of those measures, we're still waiting on the numeric outcomes for that. Some of you know that utility data is private, and so we're going through the approval process to access that. And then the solar and storage feasibility study, I included the scope of work here. I want to note that it was a very comprehensive analysis looking at what would the solar capacity be just purely based on a physical structure standpoint, what could fit on the roofs or even on ground mount, what was the energy usage and the load profiles, so where are their peak electricity usage during the day, how does that get covered by solar panels that are on site, how would battery storage help reduce those to save costs. One of the big things here, both for energy efficiency and the solar installation, would be what are the financial implications of these projects, how much could individual residents or Little Earth organizations save based on these installations. Working with IPS, they did all of this work. They were on site at Little Earth many times, looking in their different utility rooms at the meters and a lot of digging into the physical aspects. And then as they're analyzing all these things, they're looking at what are the different resources that are available to pay for these structures. What are the scenarios that we could look at if Little Earth wanted to own their system or lease their system or have a community solar garden. There's so many different options that are out there, and so what are viable and what are the implications of all of them, so that Little Earth has the full picture and understanding for any moving forward. IPS worked with Bob Blake of Solar Bear on the ground for this project. And then I also want to recognize that we received additional resources from Clean Energy Group beyond the grant from this project so that we could bring in MooGrid Analytics that has some proprietary data analysis that they can do more complex load profiles because we were unable to get the installation of time or meters that would collect sort of time-sensitive electricity usage. And so using their model, we're able to get more accurate load profiles without actually having the actual meter data. We did end up installing some 15-minute interval meters at a few of the locations, and so over time we will be collecting more of that data, and the analysis can be updated as that comes in. We're just getting in the preliminary report, so I don't have any sort of like examples to show you right now, but I'd be happy to have those conversations at a later date.
Do you actually have a timeline for when that will be completed, and will we be able to see that?
Yes, Chair. We will have the final reports within the next couple weeks, hopefully, and then it's sort of on the timeline of when they can be shared with Little Earth. They've already had some initial presentations with their boards and leadership, and then hopefully we'll have a presentation to the city, and then the conversations then go from, okay, so how interested are people in moving this forward? You know, what is the scenario that is chosen? Where do the finances come from? What is the city's role in supporting a project happening? There's, all the little details have to get figured out at that point.
Great. I have a question or comment from Council Member Gordon.
I'm just curious if the idea of the solar then is to serve all the residents in the area there, or because we talked earlier about resiliency and community building and saw that picture. But would this be solar on the community building, but also that residents could tap into? Yeah,
Chair, Council Member, it could. That's like one of the scenarios that we could feasibly do. So initially, the idea was to look at three of the community buildings at Little Earth, because in the time of emergency, if power were to go out, at least one, if not more, of those buildings could be kept up and running for essential services, like whether it's distribution of resources or whatever that might be. One thing that IPS Solar has discovered in this feasibility study process is that there are new technology out there that would actually allow individual battery backup systems to be installed for the units so people could shelter in place. Another scenario would be doing a community solar garden where more of the residents, whether they're like physically within the units at Little Earth or within the surrounding community, could potentially take advantage of that. So yeah, there's potential, but it kind of depends on which model we move forward with.
That's very interesting. There also might be some more financial options coming forward. We're looking at this inclusive financing model for energy, kind of pay as you save, so that it could be funded up front based on the savings. And I'm assuming that Little Earth owns all of these residential units. Is that correct?
That is correct.
And so do they also then provide or pay for they pay the electric bill? Or does each individual have to pay each resident pays separate?
Each resident pays separate.
Okay, so there's a chance they could save on their electric bill and see that savings go to pay for this, as well as maybe some energy efficiency, but for the solar. Okay, thank you.
All right, something here.
All right. Council members, so key ingredients for success, it's critical to note, or it's for clarification, Lyra and Lutech are two of the four businesses at Little Earth of United Tribes. So Lyra, I represent Lyra Little Earth Residents Association. I represent the social services agency of our entire organization. And then Lutech is the Little Earth of United Tribes Housing Corporation. So you think bricks and mortar. So it took even an in-house partnership to make this work and make this happen. When we're thinking about our residents and what's in their best interest. We're having conversations with our board, who also come from the community, and just other community residents who are in programming about how can we reduce for them inequities or disparities. What can we do on our end? And as you were talking about, Councilman Gordon, that was something that came to mind for us, is how do we reduce the cost of electricity in a unit? The median income in the household is approximately $10,000. And so when we're thinking long term, and we were working with IPS Solar, we were thinking about many of our residents who needed medications refrigerated. And what happens if their electricity goes out? What happens if they can't pay that bill? So when we did look at this together, we looked at the three bigger structures on property that most people kind of navigate to when something happens. But the idea is how do we replicate that or create the resiliency hub that becomes the more centralized location? So in key ingredients for success is the time and trust. Like, our community is mistrusting of non-Native agencies coming into our space and their homes at that. And so it takes working with Lyra to break down, those communication barriers to get people to open up their doors. And the flexibility and creativity on our partners who are coming in to utilize them for their information and their knowledge, and then create that communication with our residents about why this is critical and why this is important for them. And that was definitely demonstrated during our healthy home visits. We had residents who did not want somebody coming into their home at all. And so we had to be creative with how can we do this? Well, we can do it in more of our communal space. What also was fundamental in this is word of mouth, so it's coming either from a trusted staff member, or it's also coming from a neighbor or a relative in that community, and that's what was critical for making this work.
All right. I'm going to finish broadly on some of the outcomes that we had, but focus a little bit more on some of the challenges and how we navigated those and what still remains. So you've heard already about some of the direct benefits of the different components of the project, how that's built our capacity, how that provided services and products in real time to residents. Also, just in general, this, again, a very complex and ambitious project. I think it speaks to the dedication of our partners and all the staff who are involved and our own sort of accountability to see this project through, given all the constraints and challenges and the short timeline that we had. That being said, there are still areas that we didn't meet. We had hoped to do some deeper audits of weatherization audits, and the income eligibility, which is external to us to be able to provide those services, is just so onerous, not necessarily for us, but on the community partner, that we were not able to prove those income eligibility requirements and provide those services. So a real lack of synergy. I mean, it's almost like a double burden to prove how much you need something is not only wasteful, but dehumanizing. So that's a really critical need that we see. Data sharing, Kelly touched on, just challenges with sharing data, especially with private entities. And then I want to just say a bit about community trust. The week after my last training at Little Earth, the Francis Drake Hotel burned down, and that took a third of our department's staff time for a full month and a half. So when we don't have the resources and these one-time grants to sustain that relationship and flexibility and creativity, it really makes it hard to not perpetuate this fits and starts relationship that we hear experienced by a community when they're working with us at the city. So those are some challenges we look forward to finding ways to improve upon and learn from this project. I'll leave it to Jessica for our final word on their outcomes as a community partner and where we go from here.
So as I stated earlier, in order for this to have worked the way it did, for it to be successful with our residential's mistrust, it would require Lyra and the city to coexist. And so I use coexist in lieu of using the word partnership, is because at times we were both needed to be at that table. We were both needed at that front door in order to get our community to be okay with moving this necessity in their homes forward. Speaking as an Indigenous woman, speaking as a woman who's done programming in that community, I will say outright that the biggest factor for community mistrust is the one and be done. You know, you come in, you want our numbers, you want this from us, and then you all leave, you know, and so we perpetuate the trauma that has already happened for us. And so it was critical for us. We have to be flexible for our community because our community needs flexibility. It may look from the outside perspective that people in their homes have all the time in the world between 8 and 5, but the reality is people in their homes are surviving, and they are over obligated to make other appointments and whatnot. And so it was very helpful for us when we had the city coming in, being able to work beyond 5 o'clock, being able to partner in with some of the other programming that we were doing or bigger community-wide events that we were doing. So we navigated through the challenges by just maintaining open door communication. What also I think was helpful was Lyra is a very small staff. We have about 15 staff members. We have one resident advocate that covers that entire community. There's 212 units on site. And so she is overcapacitated. But what we had is we also had a board member who was also a community member helping up with the follow-up phone calls, making the cold calls, the no-shows, all of that to continue to get people moving through and forward. Let's see, so yeah, those were our outcomes and challenges that we faced. So looking forward, continuing working with the city, continuing to have the city work with us. The solar and battery storage, we're looking, yes, we're We're waiting for the results on that to figure out how to move forward next. We know that this is something that we do want to do in our community. We just don't know how we're going to do this yet. And really, the short ask is, how do we get to a place of where we're at now to having a resiliency hub on site? Ideally, when you were asking what it would look like, it would be culturally specific. We would look at having all of our programs underneath one roof, creating this one stop for our community to come to, instead of kind of moving through different buildings or through different channels. Everything that they would need would be there. Anything else you would like to add? All right, we thank you for your time today.
Thank you so much for that presentation. I love a good collaborative presentation. So you all braided that together really well. So thank you all so much for this information. It is quite complex. That's not an understatement. And I can tell by the presentation, the level of commitment to this work and to this collaboration, to this coexisting, as you said. I really am grateful for the work that you all have done in this. So thank you so much. Are there any questions or comments from my colleagues? All right. Thank you again. Seeing no further questions or comments, I move approval of receiving and filing the presentation on the 2019 Climate and Health Resilience Hub pilot from the Minneapolis Health Department, Sustainability Division, and Little Earth of United Tribes. All those in favor, please signify by saying aye. Aye. Those opposed say nay. The ayes have it, and that item carries. For our last item today on our agenda is receiving and filing an update report relating to the Office of Violence Prevention's Violence Prevention Strategic Planning Process. Welcome, Director Cotton.
Good afternoon, Chair Cunningham, and thank you, county, somewhere else. Thank you, Council, for the opportunity to present a little bit about the work that we're doing to date and where we see ourselves headed for the remainder of 2020. So we will get started. I'll be your primary presenter on our work locally, and then we also have guests from Cities United, who I will let introduce themselves, but we'll give some update on the technical assistance package and the work we're doing with them. Again, my name is Sasha Cotton. I use the pronouns she and her. So our discussion items for today will be to look at the organizational chart for the Office of Violence Prevention. We have some updates. We want to make sure the council is clear on where we are with staffing, and then also to talk about the data collection that we're doing for the strategic plan and some projected timelines. After that, you'll hear from Cities United. So we can go to the next slide. Organizational chart. Okay, this is a lovely graphic that my colleague here has developed for us, because this is his niche, not mine, to lay out a little bit about what our organizational design looks like. So at the helm, we have Gretchen Musicant, who's the Commissioner of Health and oversees all of the strategies in the Department of Health. I am blessed and fortunate to be the director of the office, which is not super new, but relatively new. I'm coming up on my 7-month anniversary, I believe, in the role, so it's still definitely feels like a new position, but I'm grateful for the opportunity. Our most recent change is that Josh Peterson is now the manager of the office, which is a huge move for us to really begin to develop and lay out the leadership team for the office, not necessarily new faces, but new roles, new bodies of work, and making sure that we're able to get both the administrative work done as well as the community work and the development and design of the strategic plan. In addition to myself and Josh, we have Aaron Sickink, who is one of our public health specialists and is amazingly working feverishly on contract work, as well as leading our Blueprint Approved Institute work. We have April Graves, who is another public health specialist and does a lot of our community engagement, particularly in North, on our CDC grant. And then we have in AmeriCorps Vista, Ellen Sheely, who is helping us with a variety of strategies and really looking at ways to engage our promise zone and thinking about the violence prevention work up in that region. We have Michaela Ferg, who is helping us think about the budget, particularly doing an audit of the budget and trying to see how our city is investing in violence prevention, not only in the office, but really throughout the enterprise, so that we can have a better picture as we go into the strategic plan around how we've invested across the enterprise and where we might have some gaps and opportunities. And then lastly, you have Jean Sawyer, who is really helping to provide some support around administrative work and making sure that we're getting our appointments and rooms and all of those things booked, and has been really an amazing add of her time to specifically supporting some of the work. So we're a small but mighty bunch, and we are in the process of looking at ways to potentially develop another entry or mid-level position with some of the resources that we might be able to maneuver this year. So.
Actually, if I can ask a quick question.
Of course.
So we've talked about the full operationalization of the office. Can you speak to what positions are funded through the general fund and which ones are grant funded?
So most of our positions are a series of hybrids. My position, I think, is the only one fully funded by the city. The rest of the positions are a hybrid of city dollars and grant funding. I know that April Graves' position is almost entirely funded through the CDC grant. There's a small percentage of her that goes from general fund. I think it's about 10%, but the balance of that is CDC funded. I'm not sure of exactly your position, but it's about 50% that is grant funded. And Jean's position is a hodgepodge of health department dollars, so it's not all OVP funded, but there's some other administrative tasks that she's responsible for throughout the health department. So it is a mixed method, but yeah, with the exception of my position, everything is a blend. Thank you for that question, Chair.
Thank you for the clarification.
So in the development of the strategic plan, we feel like it is incredibly important, and with the advice that we received from Cities United and other partners nationally that have helped to design offices to really be thorough in capturing information from stakeholders across the city, and that really speaks to the need to talk with residents. We know that that requires time and requires intentionality, but we think that it's really important that wide spreads of the community feel like they know what's going on with the office, that they're able to offer insight and perspective about how violence is impacting them, and that will help us to really focus on the things that we need to do and prioritize how the office should do its work to ensure that we're meeting the needs of the people who are most impacted by violence, while also considering the cities where violence may not be the number one issue, but that they are incorporated into the way we design the plan and our work. So our process has been a tiered approach. We have developed an online survey with our research and evaluation team that is live right now. It is designed to be a quick and easy way for constituents across the Minneapolis arena, as well as folks who work or spend a lot of time in the city. And there's a question that asks, how do you fit in? So we're really clear about who we're talking to. But we feel like it's important for people at a quick glance, 5 to 10 minutes, to be able to give us some insight about what they think, both about the issue of violence in Minneapolis and how it's playing out, but also what they would like the office to be doing and focusing on. We think that's important for prioritization. We know that with an office and its development, and as you can see with a relatively small staff, that we're not going to be able to do everything that everyone wants us to do all at once. And so it's critically important that we hear not only from you as our electeds, but from the constituents that you represent about what it is that they'd like to see us do first and how we map those things out so that people feel like they've been heard and that we're being responsive. So that online survey will definitely be available until the end of April. We may extend the timeline depending on the number of respondents that we've gotten. So far, we've gotten just over 200 respondents, which is less than we'd like, but we have some strategies. We're actually meeting with communications right after this meeting to talk about ways to really push it out strategically and make sure that, a robust number of people are able to respond to the survey.
I have a question or comment from Councilmember Gordon.
Just a comment. So I had the opportunity to see the survey and fill it out. It hardly took any minutes at all. I would encourage everybody here who's viewing this to go and fill that out. It's easy to get to, easy to fill out, and you'll provide valuable information. 200 isn't good enough. Let's get that up to 2,000 or 20,000.
Hear, hear.
Exactly. Thank you, Chair and Vice Chair. We appreciate that support. And yes, it is really easy, pretty simple, can be translated if needed. We really want to get as many people to fill it out as possible. And to the rest of the council members and those who are listening, please put it in your newsletters, share it on your social media. We really want to make sure that all of Minneapolis gets an opportunity to give us their feedback. And this is a really easy and simple way for people to do that. The second way that we're collecting information.
I'm sorry, I do have another question or comment from Councilmember Johnson.
Yes.
Mr. Chair, I was just curious if I know the survey monkeys and such can be used for different purposes. Has there been a look at trying to do something broader? I know that the coordinator's office used to do these resident-wide with Wilder surveys and really tried to use those because those are statistically going to be very accurate, whereas something where you ask people to fill out, usually like a survey monkey, isn't. Not saying that that doesn't provide useful data, because it does, but it's just a different subset or audience that you're getting data from. So have you had conversations about doing something more broader when it comes to that?
Thank you for the question, Councilmember and Chair Cunningham. We are trying to look at the widest way possible, and so we've been meeting with communications. As I mentioned, we have a conversation with them this afternoon to really think about next layers and next steps if there are other ways to push out communication, and so that is definitely a question that I will pose with our comms team to see if they have some suggestions about other modes or ways to utilize a survey tool. I think that's a great suggestion. As we're going to next move into the next strategy, we'll talk a little bit about some of the other ways that we're trying to pull in information. But thank you for the question.
Thank you.
The second way that we're pulling in information will be to do focus groups. So we want to be intentional in talking to, again, stakeholders across the Minneapolis arena, making sure that we're addressing the ethnic diversity, the geographic diversity, the experience diversity in the city. Our goal is to conduct a minimum of 35 focus groups. I'll be honest in saying that I anticipate we will do more than that. I don't want to overpromise, but I do really feel like this process is a really important way of engaging with stakeholders. We are really focused on talking with groups who already have some trust established because we want to be able to come in and ask questions that might be difficult to talk about. And we know that we don't have the luxury of time to be able to do that kind of relationship development work with groups as well as ask these difficult questions. So if any of you have organizations or groups in your ward that you think would be a great fit for a focus group, please let us know. We are in the process of conducting and scheduling survey or focus groups right now, but we're excited about the preliminary conversations that we're having and what we think will be really informative outcomes from talking with people who are not necessarily thinking about public safety, but are definitely thinking about collective impact and already working together. Our focus groups, if we could go back for 1 second, when we're thinking about design, we're looking at groups that have 7 to 12 people, as I said, some established trust. They don't necessarily need to be already focused on public safety. So when we talk about established groups, we're thinking about neighborhood organizations, church groups, parent associations, folks thinking about homelessness. We really want to tap into groups that are thinking about a wide range of subject matter and get them to give us their feedback on how violence is being experienced by their community and what they think the office can or should be doing to address it. Next slide, please. These are some of the topical arenas that we think that we'll focus on, or that we know we will focus on in talking with our research and evaluation team. These are the questions or buckets of work that they think we should really be asking about in the focus group. To understand violence in your community, what do we at the City of Minneapolis need to know? Trying to really open the door to how people are seeing the issue, what they're experiencing, what violence-related issues are not getting enough attention. We know that oftentimes we think as government folks that we know what people want us to focus on, but sometimes we're not taking the time to really ask the question. And sometimes we ask it in a very linear way where it's like, tell me the number one thing. And so we really want to give people an opportunity to not only focus on just one thing, but sort of a plethora of tiers of how the violence is showing up and what they'd like us to do. And then the last question, what forms of violence impact you or your community the most? So really trying to drill down to if we had to pick one, because sometimes with limited resources, we may have to get very, nuclear into 1 to 5 or 1 to 3 topics that we can cover. If we have to pick those things, what would you like for them to be? So these are intended to be conversation starters, not the only topics that will be covered. They will be facilitated. We are working with the Minneapolis Navigators to help us with facilitation. So our evaluation team will be doing a training with the Navigators, given that they reflect such a wide arena of the diversity in our city and are really in many ways designed to be a gap bridge between the police department, but also the city and the community on the issue of public safety. We thought that they would be a great asset to tap into. So our research and evaluation team will be doing a deep dive training with them on facilitation because we want to make sure that they have the skills and the know-how to do the work. We'll also have transcription and reflection in the focus groups. So people will both get some new skills within the city as well as having folks from community that represent those communities engaging and leading those focus groups. And then our last process for gathering information that we know and have established are some reflection sessions, and this is to some degree an ask of you all. We are looking at doing reflection sessions that will both talk about what we've gotten from people as far as feedback in the surveys and in the focus groups, but also allow in a ward by ward fashion, people to give us a reflection back as to whether or not that information feels right. We think it's really important at some point to have full-on public sessions. We know that sometimes those can be difficult to plan and challenging to get folks in the right space at the right time with all of the right pieces, but we think it's a really important thing to do to make sure that each ward is heard on how violence is showing up in their community and that we're able to take that into account as we design our plan. Our hope is to be able to do those in late spring, whether we do them one by one ward or if there are wards that want to do them in a joint effort. We think it'll be a really important process. We're hoping that we'll gather feedback and that these steps will help to inform the planning process for the strategic plan at large. So taking, again, that 3-tiered approach of a survey, the focus groups, and then some full-on public sessions to really feel like as we design a strategic plan, we can come into it with confidence that we've talked to a lot of stakeholders on the ground about what they'd like to see the office doing in programmatic arenas, as well as really how the strategic plan should be formed to address the highest needs in our city. Strategic planning timeline. So I felt like it was important to give you guys a bit of an update about where we've been in 2019. You could go to the next slide. The Office of Violence Prevention was developed by budget and by you all in the beginning of 2019, but in effect, we really didn't get started for a little while. So in 2019, we were developed in January. We're staying true to that the office was established in 2019, January. We were able, again, thank you to the council, to administrate some grants through the OVP fund in early 2019. But before having a said director, which didn't happen until July of 2019, a lot of the work was not as expeditious as we would have liked for it to have been. And that's just a strategic thing. It's not something that we could have done a whole lot about, but we are itching to go now and have gotten some things up and running. And so in September, we were able to formalize an official TA plan with Cities United and to develop some strategies, particularly around the data collection and the importance of talking with folks on the ground. In December, we were able to get Josh on board as a manager, which has been really critical in removing some of the administrative responsibilities that I was tasked with at the beginning of the year so that I can focus on the design of the strategic plan and he can help with more of the day-to-day operation of the office. And then lastly, in December, we began the data collection process to start asking those really critical questions about how violence is showing up in community.
I would like to pause right quick for some clarification. So actually, the Office of Violence Prevention was established by ordinance and partially funded by the city budget. So I just wanted to clarify so that folks understand that it was not purely budgetary, but actually that it exists now in the Code of Ordinances as well.
Thank you, Chair Cunningham.
Just want to make sure everybody knows that for the record.
That is an important point of clarification, and we will make an update to the language in the slide deck to make sure that it is reflected. You are absolutely right. I think we were just muddling with some words, but you're absolutely right. It is an ordinance and on the books, a real life thing. And I think we should take a lot of pride in that. Minneapolis is the first city in the state of Minnesota to develop an Office of Violence Prevention, which is a really important trend-setting thing. Major cities across the country are developing them, but we are one of the few in the upper Midwest. And I think it's an important innovation and an attribute to the work that you guys are investing in and that the city is holding up as a priority. So thank you. This is a strategic plan timeline for 2020. So a little bit of an update about what we think we'll be able to accomplish. So right now we are in the data collection phase. Our online survey is up and active. We are beginning to schedule and do focus groups around the Office of Violence Prevention. In April, we hope to have the Office of Violence Prevention have a soft launch. Our goal is to be able to have some logo material, at least some high-level goal and priority areas. You'll hear a little bit from Cities United, but they're going to be working with us around a marketing plan. It is one of the things that they have really helped us to highlight how important it is to make it really clear to the public what this office is, what it looks like, what it does. And sometimes as government, we don't always do the best job of doing the design work. And so having some help from them and a specialist on this issue, along with our communications team, we think will be a really important way to get some branding and design that people can easily recognize. I think as we've talked with folks in community, one of the things we've heard is that people are not always clear about the programs that we have and how the city is funding them. So we know that we're doing some really great work with programs like the Group Violence Intervention Strategy and Next Step and Inspiring Youth, but people often go to the hospital and experience Next Step and just think, oh, I had a great experience at the hospital. Or they have, a case manager through Inspiring Youth at Tubman, and they're like, my kid's having a great experience with this program at Tubman, not recognizing the city's investment in both budgetary funds, but also the design and implementation of those strategies. And so the branding will really be a tool in ensuring that people know what they're getting from their city and how the city has really over a long time invested in Office of Violence Prevention programs and now the strategic plan and the development of the office. Our hope is that by the end of summer, we will have a full violence prevention strategic plan. We would like to say that it will happen a little earlier than that, but we want to be as honest and forthcoming as we can be. And so we know that this is people driven and that it will largely be dependent on the number of people that we can talk to, because we are really focused on quality over quantity. And we don't want to just create something and say it's good enough. We want to make sure that we really have talked to a lot of people who are impacted by the need for an office and that their voices are deeply reflected in the process. And so I think that concludes my formal updates about kind of where we've been, where we're at, and the process that we're using to gather this information. At this time, I'd like to welcome Quiniqua from Cities United up to the podium to give you an update about strategic planning.
Welcome, and thank you so much.
Yes, please. Thank you. Hello, thank you all for having me. My name is Quiniqua Carthian with Cities United, and I serve as our Director of Planning and Programs. Thank you, Sasha, for allowing us to get here. We got in this morning, and this is our first activity. So thank you all. Thank you. So as some of you all know, Cities United has been in Minneapolis since 2015. You all hosted one of our annual convenings here in 2017, I believe. So we are quite familiar with the city and becoming increasingly friends. So thank you all again, Josh. For folks who are not as familiar with Cities United, so we are a national-based nonprofit who supports mayors across the country to really look at the epidemic of homicides of Black men and boys. Our goal is to reduce that number by 50% by year 2025, with the vision of really creating safe, healthy, and hopeful communities. And so right now we're in 130 cities with a goal of 500. So we have a large task, and we are excited that Minneapolis is a part of that conversation. Thank you. Real briefly, I won't go through all of our programs and services, of course, but really the ones that we're focused on here in Minneapolis. As Sasha spoke, really comprehensive public safety planning is one of the things we do the most, and we bring a number of cities, 20 to 25 a year, really walking through this comprehensive public safety plan that we call our roadmap to safe, healthy, and hopeful communities. Along with that, of course, includes strategy development and implementation, city assessment and recommendations, as well as collaborative building, community meeting planning and facilitation, and youth-adult partnership development. So briefly, the overview of the partnership, where we've been so far. I already mentioned we did the roadmap here as well. We did our annual convening. And then we started back the relationship a little bit last year. Is that correct? Last year, we're really looking at what the OVP does, that function, the core functions of the OVP, and that's where we are still now. So looking through that strategic planning process. So there's kind of 4 key areas that we've suggested. So of course, strategic planning, can't echo that enough, but also the marketing and promotions, along with the community crisis response protocol, and then measuring success, of course. And I'll walk briefly through each of those right now, depending on time, of course. So the strategic planning process and support that we've been at now, Sasha already talked a little bit about that, so I won't go into too much detail, but what I really want to focus on is the twofold, kind of looking at those 2 areas of the strategic plan, not just the citywide comprehensive part, but the OVP's work. So the role, the function, the sustainability of the OVP. So the OVP itself, and that needs a strategic plan by itself, in which there's a city comprehensive public safety plan that's being driven by the OVP. And so the process right now, where you all are, in the work that Sasha and Josh are leading, is really looking at how to do that, right? So all of the meetings, the community meetings, the data collection is really looking at how the OVP, the role of the OVP can function, the purpose, as well as some of the key ingredients that it takes to run an office. And that's that's really important to note, because with that comes a lot of limitations that we often forget about. So out of the 130 cities that we work with, there's only a handful of them who are actually doing this work right here, the work of developing an office. And I think that's important to note. So when you all were applauding that, yes, please do applaud yourselves loud and clear that that is an accomplishment that you all should be really praising, and especially through an ordinance. But with that comes a number of limitations, of course. So there's only so much that can happen out of this office. And so part of that work, you have to be very clear about the definitions that you all use. And so the work around defining what violence actually means for you all is highly important. And that will limit a little bit, that will be limited until we finish the work of some of the community planning that you all are doing. And then the second part of that is looking at the goals and the activities that the city and the community as a whole has a role in. So there's the work of the office, and then there's the work that the city as a whole and the community has to do. And part of that is the work of the office around convening, collaborating, and connecting, right? So they have to do all of that at the same time as lead the goals and the activities, which is more programmatic in nature. And so Cities United really looks through the programs, the practices, and the policies. And so that's when they break down some of the data that you all will get, really looking through all three of those areas. So what are the programs? What are the practices? What are the policies that the office really needs to pay attention to? And so those are kind of two huge pieces of strategic planning that where Cities United is proud to support, proud to be on board for, and to help walk through that process. I want to talk a little bit more also just about what this strategic planning process will hopefully come out with. So that's, of course, having a strategic plan for the office, and of course, having a citywide comprehensive public safety plan as well. Those are two very distinct but different documents. And I also want to just, if there's any questions around that, feel free to ask about that a little bit more. And that's really the strategic planning support that Cities United is bringing in and offering at the moment.
I have a question or comment from Council Vice President Jenkins.
Thank you, Chair Cunningham, and thank you, Quiniqua.
Yes,
yes, for being here and for assistance in strategic planning. I'm looking at the mission of Cities United, and I have a couple of questions. Yes. You know, it talks about ending violence against African American men and boys, which is really admirable goal that we must be focused on. But I'm wondering, in strategic planning with other communities and here in Minneapolis, is there a focus on transgender identified women being murdered in our communities? And how, if not, how can that be included in the strategic thinking? And then I guess my second question is St. Paul one of the cities, just because, you know, violence doesn't really know boundaries, right? Like,
yes.
It happens all over, and it seems like if we're going to have a comprehensive public safety plan for Minneapolis, it would be great to have some conversation with, you know, our neighboring metropolitan city right next door.
Yes, thank you for both of those questions. I'll tackle the second one first and then ask Sasha to come up and answer the first one. So yes, St. Paul is one of Cities United's partner cities. We engaged them last time we were in town, September 2019, I believe. We had a meeting with all Brooklyn Park, Brooklyn Center, and St. Paul. All three in Minneapolis, right? Of course, and you all. We had a meeting with all four, and all four cities seemed to be engaged and wanting to have a more collective conversation. So we're in these early initial stages right now, thinking through what that joint approach could look like. But we are excited about where we're going. This evening, we're having a dinner as well to revisit that conversation. So yes, they are cities along with Brooklyn Park and Brooklyn Center. Thank you.
Thank you for the question. In addition to just some feedback from the second question, we were actually advised by Cities United as well as John Jay College and the National Network for Safe Communities to do some peer exchange work, and we went to Oakland, the Bay Area, to look at variety of cities. The first city to ever have a Office of Violence Prevention was Richmond, California. So we went to go see their work, as well as San Francisco and Oakland. And I invited the person that Ramsey County and St. Paul have hired to lead their violence prevention work, Danny Givens, to join me for that site visit. So I was able to spend a week with him, really strategically thinking about what the work could look like across both Twin Cities. So we are trying to be very intentional about how we work with our partnering city across on the East Metro, as well as the surrounding suburbs in both St. Paul and Minneapolis. We recognize that people in the Twin Cities live a Twin Cities life. You know, they might live in St. Paul, work in Minneapolis, go to school in Anoka. And so we recognize that we really are representing a metropolitan community and that we have to think about the way that violence travels. We know we've seen upticks in violence that, percolates across the river. And so it is important for us to think about it that way. So thank you for that question.
A great article about you and Danny a couple of weeks ago.
Well, thank you.
It's pretty awesome. Yeah.
Thank you for that, Vice President. In regards to the second question, while Cities United is pretty linearly focused on African American youth and young men, our city will be comprehensive in looking at all Minneapolis residents. So through that focus group process, we are looking for allies. We are planning to do some focus group work with Outfront, as well as some other organizations focused on the GLBTQ community. We will be trying to take a deeper dive specifically with trans youth through YouthLink and some of the other organizations that serve young people in particular who self-identify as trans. So that's why I'm very honest in saying that I know we have an ambitious timeline, but we really want to take the time to find the right people to give us insight, and that may require a little bit more, time than what we'd like. But we think it's important. So.
I'd also like to make the suggestion of the Transgender Equity Council as a potential space to be able to do engagement, given there are advisory group on that issue. So
that is a wonderful suggestion. Thank you for that, Chair Cutting.
You got it. All right, back to you.
Thank you.
Thank you for those questions. Now I'm going to move forward thinking through the marketing and promotions work. So the second piece of Cities United's technical assistance is around marketing and promotions. And we're, excited to say that we've secured one of our partners to really help us think through this, Bill Renaissance, and with the Renaissance Creative Group, who does marketing and advertising through a multicultural lens, who has a wealth of experience looking through advertising and marketing when it comes to social impact. So this group helped around some of the social norming campaign, or not helped, developed the social norming campaign that came out of a youth violence prevention research center with the University of Louisville's public health department, a CDC funded activity. Just some brilliant work has come out of that, really looking through the city's history and culture and how to speak directly to the city as a whole with targeted approaches, and really elevating the role of youth and young people, and it's particularly individuals who've been most impacted by violence. And so Cities United promotes and talks through this approach when it comes to really thinking through how not just to communicate the work that you're doing, but to communicate the issues and the solutions as well. And so this is actually a strategy, not just to promote and talk about your individual work, but to also leverage public will and to be involved in the activities. Because again, when we think about this work, it's not just about local government leading and doing the work, but it's about the community as a whole seeing themselves in the work and seeing that they are part of the solution. And so thinking through communications, marketing, and promotions, it's vital that we think about this campaign through a campaign approach to really bring people in and not just to inform them of what's happening. That's the marketing and promotions. Renaissance Group, again, will be started thinking through what this could look like in Minneapolis, really coming down and learning the culture, learning the history of the city to come up with a good marketing campaign and strategy. Briefly, I'll talk a little bit about the community crisis response protocol. So Cities United will be providing some strategy implementation support around what it could look like when a homicide or a shooting or another traumatic event happens in the city. What do we do? Is it all emergent? Is it all 911? Is it all law enforcement? Or is there community response? Around the country, there's not a lot of things happening, but we know of a few. So we have a few people in Pittsburgh. We have New York, a number of places throughout the country, still limited, who are really thinking through this and have deployed resources to say that we all have a role when something happens, and how do we all hold each other accountable, but at the same time, how do we embrace each other when something happens? And that's looking through providing mental health resources when something happens. That looks like providing various other services when something happens in a community, and ideally not just when the news media hits, right? So we know that our people are impacted when homicides and shootings happen in their neighborhood, and are impacted on a very emotional, physical levels as well, and not just with children, but adults as well. So when things happen, well, how do we respond? And really looking through this protocol for here in Minneapolis is one of those solutions that we'll be focused on as well.
Yes, I'm not sure if you actually heard, but we have a community trauma response work group that's starting soon to address this exact issue here on a local level in our community. So
Great.
we're there. Thank you, Director Codd. All
Yes,
right.
great.
Thanks.
And then the last piece is measuring success, of course. Also, you all are doing great things right now, right? And a number of localities are lining up equally, but making sure that we praise where the work is happening, and not just thinking about some of the law enforcement numbers that go down or might change over time, but looking at all the social determinants of health that shift and change throughout the work that we're doing. But then also paying attention to the data that's a little harder to track, right? And that's more what Cities United calls dignity data. So that dignity data is a little bit of the harder things, but it's the work that Sasha and Josh do on a regular basis, really just around engaging community members, making people feel heard and valued. That's a little bit harder to do, but that's one of the tasks that we have to do in order to tell this story a little bit more comprehensively. And so we'll be thinking through that and helping Sasha and the OVP figure out that data as well. And that is all that we have right now. Again, thank you all for having us, and we're excited to continue our partnership in the work. And as we think through this, the last things I really just want to add is that this work can't happen without all of you. When that ordinance came through, we shared it with our network, all the other 130 cities, because we thought that was something that they could learn from, that they could take to their localities as well, and grow the work. So thank you all.
Thank you so much, and we're grateful to have you on board to provide us with support as we are heading down this work of innovative space. So thank you so much. Greatly appreciate it. And thank you for coming here right after you land.
Yes. Thank you.
All right. Did you want to close out?
I would only say thank you for the opportunity, Chair and council members, and also thank you for your support. It has been an ongoing journey, but we feel very fortunate, myself, Josh, the rest of the team, to be leading this work. We are encouraged every time that we have an opportunity to share what we're doing with you all, with the community, and obviously with our partners from Cities United. We are eager to see what the outcomes we can develop together will be for 2020 around creating a safer Minneapolis. Thank you.
Thank you so much. Are there any other questions or comments from my colleagues? All right. So when you say by the end of summer, does that mean like August?
Councilmember Cunningham.
Or is it September? No.
Summer technically ends September 21st, but no. I think that our goal, we recognize, I think more so than in most cities, that Minneapolis really has a weather window. And so
That's why I asked about August,
yes,
really.
We would really like to get the plan out and pushed out, even if it comes in some pieces, over the course of true summer here, which means when kids go back to school, for sure, before that time. So we will definitely keep you posted as things progress, and when we have a harder, faster timeline, we will be sure to let you know. But we certainly will be working expeditiously to get it done quickly as we can to do it justice. And hopefully before our young people go back to school in the fall, we will have a splashy thing to show you all.
Awesome. Thank you.
Thank you.
I also just want to raise and praise the power of leveraging partnerships and the power of convening that you, as the director of this office, have really demonstrated with bringing in support from Cities United. We also work with John Jay College. You also are working with the navigators in the police department, so even interdepartmental collaborations. You are doing amazing work with leveraging that skill, and it's going to benefit our city overall. So thank you so much for your leadership in that way.
Thank you for recognizing that. We really appreciate it. We do see this as an enterprise-wide, Twin Cities-wide, state, federal partnership, and that, Minneapolis is leading the way on this charge in our state, but we want to be intentional about how we leverage everything we've got to offer to make this the best thing that it can be.
Thank you. I'm also excited to hear the Brooklyns are also engaged. And I represent North Minneapolis, and we see particularly the northern end of North Minneapolis that shares a border. We do see a lot of movement in that area. So I'm grateful that they're engaged. So great. Are there any other questions or comments? All right. Seeing none, thank you all so much for being here and for the presentation. This has been very informative. I will move to receive and file an update report relating to the Office of Violence Prevention strategic planning process. All those in favor, please signify by saying aye. Aye. Those opposed say nay. The ayes have it, and that item carries. With no further business before the committee, we are adjourned.